when I'm in the clinic and I'm working with patients and I have a patient who is a little ambivalent about vaccines, hesitant, not really sure, and um, isn't quite ready to vaccinate yet, I try to start by making sure the patient knows that I'm not there to try and pressure them to change their mind, and that I'm not there to try to debunk things that they may have heard or may believe. Rather that I want to create a space where they are comfortable, where they can share any concerns and worries they have without the fear of being judged, um, or shamed or guilted or pressured, and try to make it clear that my job is not to try and tell them this is what you need to do, but rather to guide them in any way that is helpful to provide um, them with a chance to have the information they need to make the best decision for themselves. Um, so that starts with that acknowledgement, and then just kind of asking open-ended questions, trying to explore their own ideas and thoughts around it, and figure out what are some of the considerations you've given to getting a particular vaccine, and what are some reasons you might want to get it, and what are some fears you might have, and like what information could it be helpful for me to share. And starting there often will lead to some more fruitful conversations. There has been certainly been a large spike in vaccine hesitancy, anti-vaccine propaganda, and I've seen that in my clinic. I've in the last few months alone, I've had half a dozen or more patients who've explicitly told me, they they did used to vaccinate, but now they're not going to after everything that happened with COVID is usually the phrase I hear. Just I don't know, I'm not sure about it anymore. And so I hear that a lot. It's quite a shame. Vaccines are more important now than ever. The more hesitancy there is, the more that we need vaccines because the lower our vaccination rates are. And with everything that happened in COVID, there were a lot of missed visits, a lot of gaps in healthcare, and our vaccination rates have plummeted generally. And they are remaining quite low, especially in Oregon, in many areas, and that puts it at risk. Um, I think another thing it's important to be mindful of is, there's a couple reasons why there's so much more hesitancy. One is the fact that the anti-vaccine organizations, the people in the disinformation dozen, for example, they've capitalized on the fear and uncertainty around the pandemic, and they've doubled their profits at least, and probably made a lot more, from what we know, at least doubled their profits just since the pandemic, because they've been able to take all of that fear and uncertainty and channel it into new conspiracy theories and new disinformation tactics, and that's been very harmful. The other thing to bear in mind, though, is that it's not just that disinformation is spreading widely. That is a huge problem, but there's also a very real problem that the reason disinformation is so successful is because it is based in truth. There are real failings of the medical system and our government more broadly that have led people to be distrustful. The CDC has made a lot of mistakes that they haven't been as transparent about. The administration and the government broadly have not, they didn't handle the pandemic well. There's never been good transparency. There's always been a lot of civil rights infringements, and that builds distrust as well. So that communication breakdown has, I think, contributed a lot. Simple things like the way we phrase things is just often, I think, overlooked. We're in public health, we aren't very mindful of how our words are received, and in the anti-vaccine disinformation sphere, people are very much able to take advantage of what we say. So I had a patient a couple of years ago, I guess would have been mid 2021. They said they didn't trust. This is a patient who said they didn't trust vaccines anymore. They vaccinated their younger kid, their older kid completely, and now they had a new child and they weren't going to vaccinate him at all. And they said, well, it's because of everything that happened with COVID. And I said, well, tell me more. And they said, well, I just don't like that they put this vaccine out even though the FDA didn't approve it. And I was like, what are you talking about? They did approve it. They approved it, and it was nationally televised. There was it was a week-long thing where they talked about like the EUA process and the vote and how it got the emergency use authorization. And like, no, it wasn't approved. And I was like, okay, let's look into this a little. Like, I think what you mean is it doesn't have a biological license authorization, a BLA, because of the short time frame that's in process. they don't have the time to do all that, and they didn't want people to be dying in the meantime. So we passed an EUA. It approved it through an EUA. Um, and so I tried to explain this, and literally like a few weeks later, I see the headline in the media: FDA finally approves COVID vaccine, meaning that they had passed the BLA. We are using language that is reinforcing the disinformation that people are hearing. It was already approved, but we're using this term, oh, it's approved now that it's a BLA. Like, BLA doesn't matter. It's not relevant to anybody other than a researcher. Like, I don't even care as a clinician about a BLA versus an EUA, and parents don't even know what that means. But they hear authorized and approved and like, okay, well, now it's approved and it wasn't before. That doesn't mean anything relevant to your decision making. The other example is breakthrough cases of COVID. So this is a term that became popular once millions of people were vaccinated, and some of those people got sick with COVID, and we would be telling stories about, well, look at these breakthrough cases, and that is not an appropriate term. That's not a breakthrough case when someone with a COVID vaccine gets a mild COVID infection. That is the vaccine working as intended. You did not go to the hospital or die from COVID. You had the COVID vaccine, so you had a mild illness. Most people don't have any, but those who do have a mild illness. That's the vaccine working. The fact that people vaccinated are dying at like significantly lower rates, almost no vaccinated people die from COVID, is something we should celebrate. But we don't frame it in that way, and we allow the message to be misconstrued by using bad language. Those, I think, are important things to keep in mind, that we need to fight back against these profiteers who are, is stoking these fears, but we also need to be mindful of the way we're communicating and the failings of our own ability to be transparent, educate the public, and serve the public good. The emergency, public health emergency ended recently, and now we're struggling to find ways to pay for COVID vaccine for people and COVID treatments like Paxlovid that cost $500 and are going to be even more expensive. This Pfizer has said that people are not going to be able to afford. We're putting profit first, as always, because it's a for-profit system. And why would a patient who needs healthcare trust a medical institution, a pharmaceutical industry, and a government that is ending the emergency and taking away all of these provisions that we clearly can provide because we've done it for the last 2-3 years, and now forcing people to pay for healthcare that they can't afford, and pay for vaccines that they're not going to have access to. Even my clinic is struggling to be able to figure out, okay, how much vaccine can we get for COVID or for the new RSV immunization. So I think these are real structural problems that the medical system and the government and our elected officials need to contend with.